Educational.
And I'm Dr. Matthew Huebner. I'm the president of Docstar Educational.
We're going to go through a case scenario. I'm going to be the student, and Matt is going to be the mock examiner.
This is just designed to show you how the mnemonic works, and we want you to try to model your methods after this.
So I've done a couple of notes before I've taken the course, so we are going to get started. Why don't you start, Matt?
Okay. Welcome, Dr. Pronsi, to A&M General. They'll have 15 minutes to complete the single case encounter. Let me know when you're ready to begin.
I'm ready.
Okay. Your first case is a 67-year-old white male coming in by EMS. Chief complaint is dizziness, weakness, and abdominal pain. Blood pressure is 90/60. Temperature 98.9. Heart rate 115. And is there anything else you'd like to know?
I'd like a full set of vital signs, including an oxygen saturation and a finger stick glucose, please.
Okay. His oxygen saturation is 96%, and the finger stick glucose is 120.
Okay, great. What do I hear, smell, and see when I walk into the room?
When you walk into the room, you see a 67-year-old male. He is in acute distress. He does appear to be a little less alert.
Okay.
His wife is at the room. Doctor, what's going on?
Ma'am, I'm just going to take a second to take a look at your husband, and I'll get right to you. Sir, what's your name? Is he speaking to me? How's his airway?
Yes, he is speaking. Doc, my name's Gregory. I'm just not feeling good, Doc.
Okay, all right. So is your airways down? I'm just going to take a listen to your lungs real quickly, sir.
Okay.
Take a listen.
Okay, lungs are clear.
Okay.
Equal bilateral.
All right, I'm just feeling your pulse here. Feels a little thready. Nurse, I'd like you to start 2 wide bore IVs in the antecubital fossa bilaterally, and give this gentleman a 500 cc bolus of normal saline to both IVs. I'd also like a repeat set of vital signs when you're done. And I'd also like to send some labs. I'd like to send a CBC, a Chem 7, cardiac enzymes, a type and cross, and a PT-PTT. I'd like to get you hooked up to a cardiac monitor and get you undressed and onto an inning gown. Can I have the repeat vital signs after the normal saline bolus, please?
Sure. Well, you start 2 large bore IVs. The normal saline is now going. You have about 200 cc's in. Repeat the blood pressure. It's now 100/60. Heart rate is 110.
Okay, much better. Great. Okay, sir. I'm just going to check. Is he moving all of his extremities? His disabilities okay?
Yes, he's moving all his
I've
extremities.
exposed him completely. Do I see
Correct.
any metal alert tags on him?
No metal alert tags. No. He does have a wallet in his pants with the information that you would expect.
Okay, great. So I'm going to pull that out and give that to the nurse.
Okay.
Sir, I'm going to put a Foley catheter into you just so that we have access.
Okay, Doc. Whatever you think is necessary.
And then I'm going to turn to the wife. Ma'am, if I can maybe ask you a couple questions. Your
Sure,
husband's a little bit confused right now.
I'm really worried about it. You know,
we're going to take good care of him. I promise you're in a good place. It's the best hospital around here.
Okay.
I promise we'll take good care of him. I'm going to ask you a couple questions.
Okay.
All right. Do you have any does he have any allergies to medication?
No allergies, no.
Okay. Any medicines that he's currently taking?
Yes, he does take medicine for high blood pressure.
Okay.
HCTZ,
Gotcha.
25 per day. He takes lisinopril, 20.
Okay.
He takes an aspirin, a baby aspirin every day.
Okay.
And he takes Flomax for his prostate.
Gotcha, thank you. And it sounds like he has, maybe over his past medical history, it sounds like he's got high blood pressure.
High blood pressure, he's got prostate enlargement.
Okay.
That's really it.
Any surgeries in the past?
He has appendix taken out as a child.
Okay, great.
That's really all he has out.
And when was his last meal?
He ate about 5 hours ago.
Okay.
Yeah.
And so EMS, are the people from EMS still here?
Yeah, doctor's still here. We picked him up, male. He was seemed a little diaphoretic, a little pale.
Okay.
His wife said he had passed out and collapsed. When we got there, he was definitely in decreased alertness.
Okay.
As I said, tachycardic, hypotensive. Not much more to add.
Thank you so much. As far as the family, I'll be speaking to the wife. You're here. Any other significant review systems? Are you getting a headache, chest pain, difficulty breathing, abdominal pain?
Doc,
your groin, backs, blank?
I've been having some pain in my belly.
Okay.
The funny thing, Doc, here's what happened. I was going to walk in the room to have some, watch some TV with my wife.
Right.
And all of a sudden, I got this pain in my stomach, and
Okay.
I felt dizzy and weak. And my wife said I passed out. I don't really remember. I know it didn't, hit my head. I collapsed right on the couch. My wife called 911, she says, and Ever since then, I've been having just a lot of pain, Doc. Is there anything I can get for this pain?
Absolutely. Nurse, why don't you give any allergies medication? I think I asked that.
No allergies, Doc.
Okay, let me give him 4 milligrams of morphine
Okay.
IV through his left antecubital, and
Okay.
give me a repeat vital signs.
Okay.
Nurse,
Sure. 1 liter is in, Doc. We get some repeat vital signs. His blood pressure now is 110 over 70. His pulse is 105.
great. Okay, just continuing a couple more questions. Are you up to date on all your vaccinations?
Yeah, Doc.
Okay. And we talked about the events that led up to this. Are you taking any narcotics for pain?
Doc, I don't take any of that stuff.
Do you have a doctor?
Yes, I do. Dr. White.
Okay. And do you smoke? Do you drink?
I used to smoke, but I quit 20 years ago.
Great, good for you.
Yeah, no
Excellent.
drinking, no other drugs.
So listen, what I'm going to do is I'm going to do a physical exam on you. I'm just going to take a look at your head, ears, eyes, nose, throat, any abnormalities.
Okay. All right. What would you like to know?
Are his mucous membranes moist?
Mucous membranes appear to be moist. Yes.
Okay, and his extraocular movements are
Intact.
Great. And does he have any hematotympanoid tympanum or signs of trauma?
No signs of
from the
trauma.
fall?
No.
Does he have any tenderness to the midline of his cervical spine?
No tenderness.
Okay, great. Now listen to your heart. Has sounds regular.
Heart, it's regular, but it's tachycardic.
Okay.
Otherwise, no nervous scallops or rupts.
And are the lungs clear?
Lungs are clear bilaterally.
Okay, and all 4 extremities, are they intact? Are they there? Is he moving all his extremities?
He's moving all extremities. Yes.
Okay, I want to take I want to feel his brachial pulses. Are they?
Brachial pulses are there.
And I want to feel his femoral pulses.
Femoral pulses are there as well.
Okay, great. I'm gonna go down to his abdomen. What does his abdomen look like? Is it like distended?
He, on further exam, you do notice he has a pulsatile mass, palpable at the level of umbilicus,
Okay.
approximately 6-7 centimeters.
Okay, great.
It is very tender. He has good bowel sound.
So at this point, I'm obviously very concerned about a AAA, a abdominal aneurysm that's leaking. So I'm going to call the ultrasound tech to come to the bedside to do a bedside abdominal ultrasound.
Okay,
I'm
sounds
also going to call a general surgeon or a vascular surgeon if we have a vascular surgeon on call. So the nurse, I can please call the vascular surgeon and this ultrasound tech here.
The ultrasound tech is here. She places her ultrasound on the belly, and this is a AAA, an aortic aneurysm, 6 centimeters. Otherwise normal.
Okay, is the vascular surgeon on the phone?
Not yet.
All right, what I'd like to do is I'd like to have the nurse please send for 6 units of uncrossed blood.
Their CDC comes back at this point. I mean, on the sheet there is
what's his H&H?
H&H is 10 and 30.
Okay, 10 and 30. All right, I'm going to start just empirically to give him 1 unit of IV packed red blood cells.
Okay.
And continue to give him IV normal saline at a rate of 200 cc's an hour.
Okay. He's on a 2nd liter of normal saline. He's got blood typed and crossed.
Excellent. So his vital signs are, how are his vital signs?
Vital signs, he's 105 over 80. His pulse rate is still 105.
Okay.
Otherwise,
so are you still in pain?
No, Doc. That morphine really helped a lot.
Good.
Thank you so much.
Okay, listen, I think that, I'm going to bring your wife in too.
Okay.
I think that we have our answer. I think that you have an aneurysm in your belly.
Oh my
and
gosh.
it's leaking.
Okay. Is he going to be okay?
You're going to be fine. It's a good thing that you came in because this is a surgical emergency.
Okay.
We got to take you to the operating room. We've got to basically replace that section that has an aneurysm with a fake section with a graft.
Oh my gosh.
Okay? And that's going to help you. It's going to save your life in the right place, in the best positions. We have a vascular surgeon that is going to give me a call any second now.
Okay.
Your vital signs are looking much better. You're going to be just fine.
Okay. Dr. Bain, the vascular surgeon, is on the phone.
Dr. Bain, how you doing? It's Dr. Judson.
Hey,
down here. Listen, I have this nice gentleman. He's 67 years old. He came in with some abdominal pain. Lo and behold, he was a little bit tachycardic and hypotensive when he came in. His belly's been distended. He had a pulsable mass. Lo and behold, this gentleman does indeed have a AAA that's leaking. I have a confirmed bedside ultrasound, and I need you to come in right away.
How are his vital signs right now?
Right now, his blood pressure is 105 over 80 and a heart rate of 105.
That's not too bad. I tell you what. Why don't we have him see me in my office later today, and we can go ahead and take a look and see if he needs some surgery or not. It sounds like he's a little better now.
I'm gonna have to interrupt you there and tell you that I humbly disagree with you, and I want you to come in here immediately. This patient needs to be prepped immediately for the operating room. He needs to go to the OR.
Okay. If you feel strongly about it, we'll come down and take a look.
Great.
Thank you, sir. This ends the case.
Thank you. All right. So typically, what you would have, you have about 5 minutes now for our mock examiner, Dr. Matthew Huebner, to give me a critique on what I did. before I even started, I had written down a mnemonic. Our mnemonic, as you're going to see from our didactics, consists of a primary survey, which is A, B, C, D, E, F, and G, and then you're going to go on to your history, which is a mnemonic called Ample Friends, and then I just draw a stick figure and I do a secondary survey from that. And through that whole entire procedure, we are gathering information so that we can guide ourselves through the particular case. We also were looking to do things such as get the critical actions. In this case, the critical actions would have been...
Sure. Critical actions in this case would have been a thorough physical exam to identify downline aneurysm.
Right.
Immediate use of ultrasound to possibly diagnose. Another point being that you could get a CT, but you know, at ABIM in general, you're going to have a bedside ultrasound, so whenever possible, use that to your advantage. Another critical action is hydrating the patient again, getting his vital signs taken care of, and last is calling vascular surgery to take the surgery. You see that the vascular surgeons in some case, or any surgeon or any consultant may give you a hard time, and it's really important to really be the patient advocate and do what you think is right. Also, as far as where, they may ask you where this patient would be admitted. In this case, obviously, would be the ICU. You definitely want to err on the side of a higher level of care whenever possible. So, the idea is just to give you a familiarity with how it would flow, and hopefully you can practice this. You'll be having much practice with our instructors online to really refine your skills and become more comfortable with the format of the oral exam.
Thanks.